When the lights go out, the power fails at 2:17 a.m. No warning. No sirens, just darkness. Your phone has no signal. The refrigerator goes silent. The streetlights outside flicker, then die. Hours pass, then days. Hospitals switch to backup generators. Pharmacies close. Supply trucks stop moving. And suddenly, the most advanced medical system in the world becomes fragile. When the grid goes down, even small injuries become life-threatening. A simple cut can turn deadly. A fever can spiral out of control. A minor infection can become a crisis. In disasters around the world, from hurricanes to earthquakes, the first 72 hours decide everything. The question is simple. Will you be ready? Prescription medications come first. When systems collapse, pharmacies empty fast. If you rely on blood pressure medicine, insulin, asthma inhalers, heart medication, or any daily prescription, you are vulnerable within days. During major disasters, refill systems fail. Insurance databases go offline. Doctors cannot access records. Always keep at least a 30-day supply. Store it safely in cool, dry conditions. Without prescription medication, the crisis begins quietly inside your own body. Next is a real first aid kit, not a small plastic box with a few bandages. You need sterile gauze pads, adhesive tape, elastic wraps, antiseptic wipes, medical gloves, scissors, tweezers. In blackout conditions, emergency rooms overflow. You must handle cuts, sprains, and minor injuries yourself. A deep wound without proper cleaning can become infected in less than 24 hours. Over-the-counter medications are just as important. When the grid fails, stomach bugs spread, headaches increase, fevers spike. You need pain relievers like acetaminophen or ibuprofen, anti-diarrheal medicine, antihistamines, cough suppressants. During disasters, dehydration from diarrhea is one of the most common medical emergencies. These small bottles seem ordinary now. In a blackout, they become powerful tools. A digital thermometer may seem simple, but guessing is dangerous. When someone feels hot and weak, you need real numbers. A thermometer tells you if a fever is mild or life-threatening. In grid-down events, infections spread quickly due to poor sanitation and limited clean water. Information saves lives. Water purification supplies are critical. This is not just about thirst. It is about survival. When water systems lose power, contamination becomes a real threat. Bacteria, viruses, parasites, boiling water may not always be possible. Water purification tablets, portable filters, unscented bleach for emergency purification. Without clean water, illness spreads faster than panic. Wound care and infection control come next. In a grid-down world, antibiotics are not easily available. Stock antibiotic ointment, iodine or chlorhexidine solution. Sterile saline for wound irrigation. A small untreated cut can lead to sepsis, and sepsis kills quietly. Emergency trauma supplies can mean the difference between life and death. Most emergencies are small, but some are not. A serious accident, a deep laceration, severe bleeding, you need a tourniquet, pressure bandages, hemostatic gauze. In mass blackout situations, ambulance response times stretch from minutes to hours. Severe bleeding can cause death in under 5 minutes. A printed medical reference guide is often overlooked. When communication networks fail, you cannot search symptoms online. A handbook guides you through CPR, shock treatment, burn care, infection signs. Under stress, memory fails. A book does not. Backup power for medical devices is critical for vulnerable households. If someone relies on oxygen machines, CPAP devices, or refrigerated insulin, electricity is life. Portable battery stations, solar chargers. Backup power systems. During past grid failures, vulnerable patients became emergency cases within hours. Finally, personal protective equipment. In every disaster, one invisible enemy spreads fast. Disease, masks, gloves, eye protection. When sanitation systems fail, infections multiply. Simple protective gear dramatically reduces transmission. Most people prepare for food shortages. Few prepare for medical isolation. In large-scale blackouts, hospitals operate on limited power. Staff shortages grow, supply chains collapse, governments restore services, aid eventually arrives, but not immediately. The first days belong to you. Prepared families stabilize injuries, prevent infections, stay calm. Unprepared families panic, and panic leads to mistakes. Imagine the silence again. No hum of electricity, no glowing screens, no emergency hotline, just you, your home, and what you prepared in advance. Medical readiness is not fear. It is responsibility. You do not need a hospital in your house, but you need enough supplies to bridge the gap between disaster and recovery. Because when the grid goes down, the real question is not whether help is coming. It is whether you can endure long enough to see it arrive.